In this presentation, I will take us through how to differentiate between blood clot and papillary projection. This is based on this landmark paper published in the year 2000 in the Wired Journal, titled Terms, Definitions, and Measurements to Describe the Sonography Features of Adnexal Tumors, a consensus opinion from the International Ovarian Tumor Analysis Group. The consensus statement says solid means exhibiting high echogenicity, suggesting the presence of tissue. Examples are the myometrium, the ovarian stroma, myomas, and fibromas. It went further to say that methods to distinguish between blood clots and the presence of solid tissue involve pushing the transducer gently towards the structure and looking for internal movements and the use of color Doppler imaging. Importantly, the Doppler settings must be appropriate. If there's any doubt as to whether the lesion is blood clot or solid lesion, it should be classified as solids. Again, solid means exhibiting high echogenicity, suggesting the presence of tissue. Example, myometrium. The ovarian stroma, myoma, and fibromas. Now let's look at blood clots. This was a 29-year-old para-3 who presented with acute abdomen, discovered to have torsion at laparotomy. This is the bladder. This is the lesion, pushing the fundus of the uterus down. So the description by IOTA is with the use of transvaginal probe. But even with transabdominal probe, one will be able to demonstrate movement within blood clots, as we shall see shortly. So here you can see this heterogeneous lesion. So this is blood within the cavity. So blood clot will move on probe pressure. Look at this movements. So this is blood clot, not papillary projection, and you can see that this was confirmed at laparotomy. This again was a gravida 4 at 13 weeks with twin pregnancy with spontaneous severe ovarian hyperstimulation syndrome. This was the second image taken 2 weeks after. Not the blood clot and the diminution in size here. And on probe movement using trans-abdominal scan, you can see this movement. So even if this measures more than 3 millimeters, it cannot be said to be a papillary projection because it is not a solid tissue. This is blood clot and not the movement. Blood clot will not take up color. What has taken up color here is the septa, not blood clot, because blood clot is not a live tissue and so will not take up color. Now this is a 21-year-old being evaluated for infertility, not the movement here. So this is blood clot, not papillary projection. You can see the still image here, color flow within the walls, but not within blood clots. This was a case of slow leaking ectopic pregnancy, not the blood clot, and not here. You can see a detachment of blood clot. You can see it gravitating here. So blood clot moves on probe pressure and does not take up color. This is a 3D image, and even from the appearance, it looks more like a pellet clot than a papillary projection. This was a case that was seen at 10 weeks of gestation and was thought to be a solid lesion. With application of Doppler, you can see the ring of fire around the corpus luteum and the absence of flow, in this case of corpus hemorrhagicum. She had an uneventful pregnancy. This was a case of endometrioma. This is sludge, not papillary projection. Now let's look at papillary projections. This was a 70-year-old being evaluated for advanced ovarian cancer. You can see the uterus here, sandwiched by this tumor. So let's look at the irregular cysts. So you can see the papillary projections are not moving with prop pressure, not the irregularity of the cysts. This was a 20-year-old nolip who complained of on and off lower abdominal pain. Now, let's look at this cyst contents, the multiloculation, the irregular septation. But our interest for this presentation is the papillary projection. So this is a papillary projection, which has taken up color. Now let's look at these papillary projections and use the line diagram to demonstrate the number of papillary projections seen in this image. When the difference is less than 50% as seen here, it is considered as a single papilla. When it's more than 50%, it is considered as two papillary projections. So here you can see this papillary projection, and then you can also see another papillary projection. So how many papillary projections do we have here? 1, 2, 3, 4, or 1, 2. So this has clearly demarcated the papillary projections. Here you can see the indentation here and here are less than 50%, while here is way beyond 50%. This is the image after surgery and not the papillary projections observed during ultrasound. So what are we dealing with? 1, 2. Look at the specimen of surgery. Clear demarcation of the two papillae, 1 and 2. So we have two papillary projections here. This is important when imputing this information into the ADNEX model because it has prognostic implications. This 35-year-old was observed to have increase in the size of the cyst, and so she was referred for expert opinion. This is a single papilla. It was a solid ovarian tumor with a cystic component, which is irregular, containing a papillary projection. 70-year-old with multiple papillary projections and a wall excrescence. Note these echogenic areas here representing some bodies, just confirmed by histology, and not also this external excrescence. So our take-home message is that blood clot can be differentiated from papillary projections because blood clot will not take up color and blood clot will move on proper pressure. When there is doubt as to whether one is dealing with a blood clot or a papillary projection, the worst case scenario should be used. Thank you very much.